Hello. Thank you for your interest in the Oregon Health Insurance Marketplace Community Partner Grant Program. If you're seeing this page, you are in the right place. The RFGP materials can be found under Community Partner Resource Center on OregonHealthcare.gov. Once there, scroll down and you will see 4 links to the documents you will need to review and submit to be considered for the grant. The first document to review is the 2020 DCBS Community Partner RFGP. Click the link for more information. Once the document opens, you'll see a description of the Community Partner RFGP. If you see this on your screen, you're in the right place. Please note, this document was issued on May 1st, 2019, and proposals are due May 31st. We anticipate announcing the grant recipients on July 1st of this year, and a grant start date of August 1st. You can submit your proposal via email to dcbs.opportunity@oregon.gov. The single point of contact for proposals is Margarita Nunez, our procurement specialist. In order to ensure you have a strong, competitive proposal for this grant cycle, let's review each section of the RFGP to ensure you are clear on what each one means. The first section explains the purpose and overview. The next provides some background, including funding availability. Be sure to read the funding availability section carefully. It describes the amount of funding available, the grant cycle, and what recipients will be expected to accomplish. The next section describes the scope of work. It provides outreach and enrollment definitions and the benefits and requirements of receiving a grant from the Department of Consumer and Business Services. In this section, you'll learn about the monthly reporting, as well as other important items like the dollar range of the grant. Section 5 provides details on the term of the grant. In this case, the grant cycle will be August 1st, 2019 through July 31st, 2020. Section 6 describes the priorities and standards of the Marketplace Community Partner Grant Program. Section 7 details the specific requirements for a successful proposal. It includes general, technical, and budget guidelines. Read this section carefully and reach out to Margarita, our single point of contact, with any questions you have. The final section of the RFGP is the Evaluation and Awards section. All submitted proposals will be evaluated based on the criteria provided in this section. It also details the selection and award process, as well as some legal guidelines. Do not forget to complete the 2 attachments on the final pages of the RFGP. The first is a cover sheet, and the second is a confidentiality statement. The next document to complete is the Community Partner Attachment 3 through 6 Technical Proposal Budget and Special Consideration. Click that link next. This is where you will provide proposal information that will be considered by the scoring committee. Section 1 of Attachment 3 is where you'll describe how your qualifications and experience make you a good fit for this grant. It's worth a maximum of 25 points. The first question asks about existing relationships and the positions of trust with populations you propose to reach. We want to understand how you reach the populations you are proposing to work with and your experience in building that relationship. It is a priority for DCBS to reach populations that are underserved by health insurance and health coverage. We want to make sure every community partner we work with has the capability and experience of working with disadvantaged communities. The next question, located on page 2, asks for your experience with outreach strategies that support health insurance enrollment, including an assessment of the effectiveness of those strategies. Be specific and honest describing the strategies you have used with outreach and how effective they were. Use this section to show your ability to understand what has been effective and what strategies have not. The next question, in the middle of page 2, asks you to describe some successes and challenges conducting outreach to your audiences. Be sure to discuss how the outreach strategy you are planning may be affected by the communities you are targeting. As you work with different communities, you may come across some unique challenges. On the other hand, you may be successful with those communities in specific ways. For this question, go into detail about the communities that you serve, the region you serve, what challenges you see, how you might overcome those challenges, and provide strategies you might use to achieve success. Please be specific and use as much detail as possible. If selected as a grantee, you may be called upon to help us develop promotional or informational materials to aid with your outreach efforts. The third question on the second page asks you to describe your experience creating or using promotional materials in your outreach. The first question on the third page asks about your organization's experience with collaborative community actions. In this section, describe any time you have collaborated to achieve goals with other partners, or any time that you have worked with a group outside of your agency to accomplish a goal. Examples could include partnerships with DCBS, OHA, other state agencies, or other community-based organizations and nonprofits. The second question on the third page asks about your organization's strategies to help support consumer enrollment with health coverage. Provide strategies you have used and an assessment of the effectiveness. Similar to the previous question about outreach strategies, it's not important that every enrollment strategy be successful, but if it wasn't, show you understand and can explain what you might do differently. The final question on the third page asks for specific successes and challenges providing enrollment assistance to your service population and region. If there are certain population-specific challenges or benefits related to enrollment, describe those in this section. Also describe region-specific barriers and advantages you anticipate or have experienced relative to enrollment in health coverage. The final question in the Qualifications and Experience section asks about your agency's history promoting health coverage enrollment support, including an assessment of its effectiveness. In this section, provide information about when you gave enrollment support to your identified communities and what you did to ensure those populations understood that health coverage enrollment help was available. Don't forget to assess the effectiveness of these efforts. Section 2 asks questions about your grant plan, shifting focus from how things have been in the past for your organization to your plan during this grant cycle. There's a 50-point maximum for this section. The first question in Section 2 asks you to explain how your proposal expands the current work of your organization and how you would use the grant to create a new outreach and enrollment model. Describe how this grant plan coincides with the work you are currently doing and how it could expand your agency's mission. The first question on page 5 asks about the audiences you intend to reach with your outreach and enrollment plan. Here, you will describe the specific communities you intend to serve. You can include multiple communities if you wish. In the next section, for each community that you intend to serve, supply specific goals, including activities, major milestones, and success measures. Feel free to add additional goals or audiences to the proposal. Be aware that the first part of the goals section should be specific to outreach, while the second half is enrollment specific. The last question on page 8 asks for the names, titles, and FTE of each staff member working directly on this project. If you intend to hire someone, provide the expected date of hire and the position title as well as the FTE. The first question on page 9 asks for information about the service area in which activities will be performed for this grant. We would like specific city and county information. It is okay to identify multiple cities and counties for your activities. The last question on page 9 asks for outcomes to be completed by the end of the grant cycle. These numbers will be considered the starting estimate and may be adjusted during the work plan and contract negotiation if your proposal is selected. The first question in the outcome section asks for the total number of new qualified health plan applications you will assist with during the grant cycle. This is counting folks who did not previously have health insurance but have come to you for assistance in applying for a qualified health plan, also known as a QHP, on healthcare.gov. The next question in this section asks for the total number of renewal applications assisted. These are the folks that currently have a qualified health plan that are returning to receive assistance on getting their insurance renewed for another year. The next question asks for the total number of applications submitted for qualified health plans. We're trying to capture how many people apply for plans on healthcare.gov through community partners. Applications counted in this question include only those that have been submitted to healthcare.gov and may be duplicative of the numbers requested above, but may not be. For example, consumers can come to you for help with a QHP, but that help may or may not lead to an application being submitted. In the case that you provided assistance for the consumer, but they did not actually apply for coverage, you may count them in one of the two previous questions, but would not count them on this question. This information is important to help you create an effective work plan proposal. Another question that may interact with the previous questions is the incidence of application assistance. This question is attempting to track the number of times a consumer or consumers contact you for assistance. There could be multiple incidents of contact per household, and you will track them all here. In other words, if a consumer calls, sends email, leaves a voicemail, or makes an attempt at contacting you regarding a qualified health plan, each one of those contacts, achieved or attempted, would count as application assistance. The next question asks you to propose the total number of networking meetings you will attend through the grant cycle to promote qualified health plans. This metric will track the situations where you meet or network with an individual or group to inform them about your outreach and enrollment services. Examples could be community-based meetings, speaking engagements, or collaborative meetings with several agencies present. The next question asks you to propose the total number of outreach contacts your organization will accomplish during the grant cycle. This can include tabling, advertising, social media, news media, radio, etc. With outreach contacts, we want to know the number of people that could have been contacted by your outreach. During tabling, for example, we're looking for the number of folks that you connected with face-to-face. But with advertising, social media, news media, and radio, we're looking for the proposed reach of each of those categories. The following question asks the total number of brochures, flyers, and other materials you will distribute during the grant. We want you to propose how many printed materials you will provide to folks to promote the program. The final question in this section on page 9 asks for how many times you might pass a consumer to another community-based organization that might be able to address their needs more completely, or times you might pass a consumer to an insurance agent to complete their enrollment. Page 10 moves us into the budget proposal known as Attachment 4. There is 25 points available. Use the key for help filling out the budget. Be specific in itemizing your expenses, but also remember this is a proposed budget and there will be a negotiation of these items if you're selected as a grantee. During the grant year, these budgets will be somewhat flexible, and line items can be moved with approval if what was proposed at the beginning of the grant cycle was later determined to not be an effective use of resources. You are asked to demonstrate a rationale for the amounts included on your proposed budget. You do not need to itemize expenses in the indirect category, but the template includes indirect amounts in categories in case you want to display them. While you will propose an indirect amount not to exceed 12% of your grant total, you will actually use your monthly invoices to determine the amount of indirect expenses you can include. Page 16 is Attachment 5 of the RFGP and asks you to propose a QHP-related project which will be completed by your organization during the months following open enrollment, when that outreach and enrollment is slower. We are open to any type of project in this section as long as it relates to qualified health plans, the Oregon Health Insurance Marketplace, or outreach, enrollment, education of the public on health coverage. Be creative. We are interested in hearing what you think might be valuable. For help, take a look at the possible examples of projects to consider. Page 18 is Attachment 6 of the RFGP, which asks you to provide items of special consideration. This can provide a maximum of 25 points to your proposal. The first question in this section asks for a description of the capabilities your agency has in serving consumers who primarily speak languages other than English. Serving individuals and families from a variety of cultures and backgrounds is important to the marketplace, and because of that, having the capacity to provide services in many languages is essential to the proposals we receive. The next question asks about your proficiency in working with underserved or underrepresented groups. Provide detailed examples of your experiences working with the highlighted groups or any other group that fits into these categories. The last question in this section asks to describe your organization's existing connection with Oregon Health Plan assisters and/or health assurance agents, or your plan to develop such a relationship with the help of DCBS. The marketplace believes it's important that Oregonians are provided with assistance on getting health coverage, no matter what program they may be eligible for. We have a no wrong door policy that includes providing assistance for consumers who might need support applying for OHP. If this is not something your agency already does, do you work with another organization who does? Do you have a plan to develop a relationship if one doesn't exist? What will you do if someone would like assistance in applying for OHP? Tell us about that here. Also, what if a consumer might be better served by working with an insurance agent? Would you know who to refer them to? If not, how will your agency address that need? The final Community Partner document is the Community Partner Grant Checklist. This checklist is intended as a guide for you. Follow the list and check items off as you complete them to make sure nothing was missed before submitting your proposal. Again, please email your proposals to dcbs.opportunity@oregon.gov and contact Margarita Nunez if you have questions about completing your grant proposal.